when you're in dental school, they seat you by your alphabetical order.
Okay.
So
you're right in the middle.
So for 4 years, you're next to the same people all 4 years.
Okay.
And so it really, people around me got really upset with me because I didn't read the assignment, of course. Like, okay, so we would go to do lab work and I'd go, Todd, how do we do this? And he's like, didn't you read it? I'm like, no. So then he'd explain it to me and then I would beat everyone doing the assignment because I had things to do. I had to get it out.
Yeah.
And so that just, it infuriated him. And okay, I got to tell you this one thing. Other than I got caught one time. I had to make a crown for a patient.
Okay.
And so we had to do so many gold crowns for our patients. And this one gold crown that I had to make for this one guy, it was taking me forever to figure out to be able to do it. And anyways, you have to wax the tooth. You have to what's called invest the tooth, and then you have to pour the gold, and you got to put it in a centrifuge, and then you have to polish it. I was just finishing the entire process, and I was finishing at midnight at night, and I was seating it the next day. So I had this brand new gold crown. I paid. Here's the other thing people don't understand. When you're in dental school, you have to pay for all the materials. I paid for this guy's gold. I did all the work. I had invested, had everything. It was beautiful crown. I was just getting some of the powder off and it slipped out of my fingers and went down the drain. I could not find it. I mean, I couldn't believe it. Here it is, this brand new, and I see it go down the drain. And I was just like, I was distraught. And I went, bag this. Went to my truck at midnight, got my tools, came back, took the trap out, found the gold crown, rinsed it off, seated it the next morning.
I can't say I wouldn't have done the same thing.
Yeah. Well, I was grateful that I at least knew what to do. But
yeah, true.
Yeah. Anyways, well, thanks for being here.
Yeah. Thank you for having me.
So how long have you worked with us?
Almost 2 years.
So it's been 2 years.
2 years. I've been a hygienist for 9.
So where did you work before?
So I've worked at a couple different offices.
And you hated them all, didn't you?
No, actually, I didn't hate all of them. No, they have.
You hated some? The way you said that.
There are things I didn't like.
What is it that you didn't like?
I want respect. And if it's not an open communication and open respect thing, I don't
How long
feel
did you
valued.
work there?
3 years.
So you knew you weren't respected, yet you still worked there for 3 years?
Yes.
Why would you do that to yourself?
So I worked at that specific office because I was a single mother and they had benefits.
Oh.
And I needed to prioritize my son. And I chose him over being happy. And
was it a corporate office?
It was a corporate office. And that was really hard for me because it was all production based.
So how is that working for corporate? I mean, seriously, you always are hearing what it's like. Me being a private provider for my entire career.
Right.
I know a lot about corporate, but I've never actually worked in that environment. You have.
Yes, it is hard because it's all money driven. Everything that you are told to do is based off of money and not what is good for the patient necessarily. And that bothered me. And
did you have like quotas and things like that?
Yes, you had daily goals, daily production goals.
What if you didn't meet those goals?
You got talked to. And I got talked to quite a few times because I'm sorry, I'm not performing surgical periodontal therapy with somebody who doesn't need it. That's wrong.
So did they have like a percentage that you had to meet?
Yes.
Okay, you just saw 10 patients. You should have done periodontal therapy on 4 of the 10 that you saw.
Yeah, there was a certain number I was supposed to hit, and I got a bonus every time I did that. So they would pay me X amount off of every SRP that I did, or extra sealants or fluoride, and we saw some Medicaid patients, and those Medicaid patients, because Medicaid will pay for x-rays every 6 months, they would make us take x-rays every 6 months, whether they needed them or not. It didn't matter. And it bothered me to my core. And
Well, that's not medicine.
that is not. That's money driven. And at the end of the day, I pushed back, and I'm not doing that. They don't need this. This is wrong. I'm not doing it. And so kind of butted heads. And as I've gotten farther along in my career, I've realized that at the end of the day, I want to be able to sleep at night. And I
So
want to
was
do.
the doctors the one making the decisions?
No, the doctors are employees. It's completely, you don't get a say in it.
So
And
did you work with corporate managers?
yes, and they would come in and they had their own HR department. And yes.
Oh, wow.
Yeah. So that was, I've seen a different side of dentistry that I didn't like. And my final straw was,
Okay, so I'm going to ask you.
yes.
You don't have to tell me which one,
Okay.
but just tell me if any of these were one of them. Okay.
Okay.
Okay. Willamette, Aspen, or Pacific. Those are kind of the three biggies.
Mm-mm.
Not one of those three?
No,
I missed one?
you did.
Mm.
It's actually, they have all of their offices only in Idaho.
Oh, only in Idaho.
They've taken over 22 offices in Idaho. They buy out dying practices and then revamp them. Yeah. So it's two local brothers that have bought out other practices and made it big.
Oh, I get you. Okay, so they've taken those and
Because they were private at one point. The two brothers were private, and
so
they've gotten bigger.
The problem with that then
Yeah.
is that they've kept the identity of the private name, probably.
Yes.
And so patients don't know that it has went corporate.
Exactly.
Ooh.
It's
So
sketchy.
as a patient, could a patient ask who, you know what? That's actually a really good question to ask. For the patients that are out there, there's one question that you could ask. Who is the owner of this dental practice?
Mm-hmm. That's a good question.
And if it's not one of the doctors that is working at that dental practice, that would give you a red flag that it potentially is a corporate office, and that the decisions are not made by the doctor. The decisions are made by a corporate meeting or kind of a board of the decisions that are made at in that office, correct?
Yep.
Mm.
Yeah, they come from higher up. And there was one time we were told that Smile Direct Club patients were going to come in and be evaluated by us. And I said, absolutely not. I will not be part of that. And look who went bankrupt.
Yeah, well, Smile Direct Club was an orthodontic, direct orthodontic practice.
Yes.
That was like Invisalign, except it wasn't Invisalign. It was much worse.
Mm-hmm.
And so you didn't ever see any doctor. You would just take your own impression, send it in, and it went bankrupt. Do you know why it went bankrupt?
I honestly don't know.
They had so many lawsuits because they had so many problems.
Yeah, they were doing orthodontics for patients that had gum disease, and
there was no way that and so I do see there we know that AI is going to be in every industry.
Mm-hmm,
I think ortho is going to be the big one. I think it's going to absolutely revolutionize the way we do ortho. My big thing is Airway. And so I see doing ortho much earlier and making bigger changes for patients.
Yeah.
And hopefully it will be a good thing. Hopefully it will be a good thing.
Mm-hmm. For their long-term care.
Yeah. So
they need that.
What is the worst thing that you've seen in dentistry by other offices that you've worked with? Like, I can't believe the work that they did on this patient.
Ooh, that's a hard question.
I know. That's why I give you the hard questions.
Actually, the one that sticks out in my mind was I was brand new hygienist, and I had just had my son, and I worked in an office in Montana for 1 year because I couldn't find a job out of hygiene school.
Really?
Nobody wants to hire you when you're 6 months pregnant.
Oh,
usually,
I do all the time.
I know you do, but you're like the unicorn. So yeah. I took this job and I moved to Montana, and this doctor, this gal came in and she had never been seen by a dentist. She was in her 50s and she had so much calculus all over her teeth that he couldn't extract them. And he had told me, he said, I need you to Cavitron and get all of the calculus off so I can extract her teeth. And I tried. There's no way the Cavitron, he had to use a burr to get all of the calculus off to separate the teeth to get them off. It was so bad that it was under her tongue all the way, canine to canine, all the way under her tongue, like a big chunk. And because there was so much bacteria in there after he had pulled all of her teeth, she ended up in the hospital on IV antibiotics because of the bacterial load. And it took over her body. And
So he took out the teeth and gave her a denture?
He didn't give her anything yet because he wanted to see how she was going to heal from that because of her bone loss. And I'll never forget that poor woman's face. And I mean, just black and blue. And in that moment, I knew, okay, well, I signed a contract for 1 year. When I'm done, I'm moving. And I left because that just gave me the ick. And I've seen quite a few.
So how is it
things.
working for a doctor? I imagine nurses feel this way. I imagine anybody that works under someone in the medical field,
Mhm.
and you completely disagree with the treatment that is being told to the patient, and you
Yes.
just have to sit there and bite your tongue.
And I have a hard time doing that sometimes.
Oh, I know.
I am vocal.
And here's the difference in my office. Have you ever felt like you couldn't be vocal in front of the patient?
No, absolutely not.
We talk about it all. I want you to.
All the time.
Yeah.
All the time. Actually, the last office that I was in was the corporate office, and the doctor I originally was hired with, he decided to go and open his own practice, and he moved to California, which, I mean, I respect that. He wanted to do his own thing. He left and they hired another doctor, and this doctor was, I mean, he was awful. He was awful. He cut open patients' tongues with burrs. One patient had swallowed a burr. It was bad. And he had told this patient of mine that the patient wanted to have their lower retainers removed. And so he said, you need a hard retainer at night at least to wear, which I absolutely agree with. But I told the patient, I said, go back to your orthodontist and have them make it. Most likely it will be cheaper. And he fought me tooth and nail because he wanted to charge this patient $800 for retainers. Just one retainer on the lower. And I just didn't agree with it. And I butted heads. And I looked at the patient and I said, if it were my mouth, I would go back to an orthodontist that I trusted.
Mm. Was the doctor there, though?
I said it right in front of him.
Wow. Wow, that's pretty impressive. Wow, you kept your job?
I actually gave my resignation that day, and I applied to your office. So that was my straw.
So you gave you the courage to be able to be honest with the patient.
Yes.
Have you ever been in a situation where the doctor has said something that you knew they were just selling the patient? So let me give you, here's what happened years ago. I think I might have even been in dental school, or maybe just fresh in dental school. There was a news reporter. He went to a doctor that he trusted,
Mm-hmm.
went in and found out that and he wanted to be clear of any decay. They did x-rays, wanted to make sure that he was okay. And in that dentist that he trusted opinion, he was okay.
Okay.
He went to something like 20 or 80 offices.
That's a lot of
and
offices.
as a investigative reporter. And he had anywhere from, I think it was an $80,000 treatment down to nothing. So some dentists, the good ones, had seen that there was nothing
to do.
Some saw a few things that they disagreed, I guess, and saw that there was a few things that would all the way up to 20, 40, 60, $80,000. And he said, the only reason I'm here is I just want the things that needed to be done. that he had full mouth rehab cases. It was your
Interesting.
occlusion is off. He didn't complain of his bite being off. It's just, no, your occlusion is off and we need to treat you. This is going to be $15,000. And so it hit the ADA. I mean, it was a huge deal in the dentistry community,
Yeah,
because it just put a really bad light. Well, the reality is that if you see 7 dentists, you're going to get 7 opinions.
that's true.
And so it's very difficult for patients to be able to determine, are they really telling the truth? I mean,
Well, that's like any medical provider, truly.
that's
I
true.
mean, you have, as a provider, you kind of have the leeway of using your own judgment to make calls.
Well, so okay, here's one good thing that a patient could do is, if, let's just say there was somebody across the country that was watching this and they were like, well, how would I know? What would you tell them that they could do? Let's say like we have in our office, to verify if they had, let's say, cavities.
Well, we have an AI software, and I think it's phenomenal. I mean, obviously, it's a second
What's it
opinion,
called?
Pearl AI.
So
And
explain that, and what does that look like for patients?
so Pearl AI is our software that we use, that when we take x-rays, it is uploaded into the software and it's able to highlight different shades of gray. And, you know, the untrained eye can see usually around 30 to 50 shades of gray.
Correct. Yep.
A trained professional is around 70, and then AI sees around 800 shades of gray. And it's kind of neat to show patients the purple highlighted areas, like, yes, this is a watch spot because it hasn't gone past the enamel, or yes, this is into the dentin of the tooth and that you need a filling or a crown or something like that. And one thing I love about our office is that we show them. Not only do we show them with the AI software, we use a mirror. We show them in their mouth, like, here is the spot that you're looking at that you need to be concerned with.
But with this AI, what's nice is that, I mean, we've got 55-inch screens. We pull up the image in front of
Yes.
their face, and then we literally say, okay, here is what the AI had detected.
Yes.
But even though AI has detected it, you've looked at it,
Mm-hmm.
you verify it.
Yep.
Then you come and get me or Dr. Hyde.
Yes.
Then we verify it. And there's quite a few times that I'll look at the AI and go, no, that's not right.
Yeah.
And
But use your critical thinking skills.
right. And
yeah.
so I'm able to do that. But a lot of times it's correct.
Mm-hmm.
The one thing is that I'm not going to find something that AI did not detect.
Yeah.
Almost never does that happen. So what someone could do is just ask a simple question. Do you use AI? The company that we use is called Pearl. Do you have Pearl in your office, and can you show me the issues? Because you as a layperson are not going to see the grays like we see it. And so what happens is that with the AI, it shows you in red exactly where the problem areas are. And if there's no problem areas and the doctor is saying you have problem areas, then you've got a problem.
Yeah, exactly.
You have a problem with where you're at. So yeah, I think that's really interesting. Anything else that a patient could do?
I mean, I honestly question everything. If you honestly don't know if you have it, get a second opinion. It never hurts.
So what I often say is trust your gut.
Mm-hmm.
If your gut is telling you something's off, then I can't tell you how many times you've seen it, patients that will come in. Well, I just went to somebody and they said I had 7 fillings, 7 cavities that need to be done.
Mm-hmm.
This crown need to be done. And we look at it and go, we don't see anything.
Yeah. Or maybe you have one.
Yeah.
Or yes. But one thing I love about our office is that we truly care about the patient. Like, that motivates me more in my career than a lot of things have. Like, we truly.
How many more years are you going to work?
I honestly don't know.
No, if you're going to guess, like right now, you're going to say, I'm going to be this old when I finally retire from all of this.
Hygiene. So my end goal is to eventually teach.
Oh, good for you.
And the reason I say that is I want to be able to travel, so I want to be able to teach online.
So where would you teach?
I don't know, but I don't know if I would do like clinical dental hygiene or if I would do like a biology class online. I just want to be able to travel
Good for
later
you.
in my life. So I say I have at least 20 more years in me of hygiene, and then I want to go do my own thing. I want to have a trailer, and I want to go travel and see the world and experience things that you can't do when you're
You want to go to
right down.
Oklahoma, get in a twister, and be in a trailer?
Yes.
Is that
Yep.
is that
Yep.
your goal?
Yeah.
Okay.
No, actually, one of my bucket list goals is to see all of the national parks. I want to do that.
Which ones have you seen?
I've seen Yellowstone. I've seen the Redwoods, Crater Lake. I've only seen like 3 or 4 of them. So
Grand Canyon?
I'm not.
Okay. Have you seen the vacation movie with Chevy Chase?
Yes.
Okay, you know how he drives up and he looks over the Grand Canyon and
Yes.
he's like, "Okay, let's go."
That's pretty much it.
Literally the way I felt. I was like, "Okay, I mean, it's amazing to see it."
Phenomenal, right?
And then it's like, "Yeah, okay, let's go."
Once
And
you've seen
was-
it, you've seen it.
Well, and then I did another trip. I did. I took a helicopter flight.
Oh, was that amazing?
Well, not as amazing as I thought. So
Okay.
here's the crazy thing about the helicopter flights. The only ones that are allowed to land helicopters into the Grand Canyon is Indian tribes. So you have to do it on Indian land.
Interesting.
And the helicopter tours are all from Vegas.
Right.
Guess how much they have to pay the Indians per year to just land their helicopter near you really don't see
I wouldn't even know.
$1 million a year just to land it. That was years ago. It's probably like 10 million now. Yeah, just to land in.
Interesting.
So when we landed, it was in the summer. It was 143 degrees.
I'm good.
143.
I'll stay at the top.
I was like, I didn't even know it got that hot. But yeah, it was 143 degrees where we were at.
Well, no wonder they don't want you landing there.
It wasn't like what you think of the Grand Canyon.
Mm-hmm.
The awesome Grand Canyons, there's certain spots, and it is amazing. But Zion's, you need to go to that. Bryce Canyon, you need. In fact, I think Zion's is better than the Grand Canyon. Because Grand Canyon, you go to the top and you look down.
Right.
With Zion's, you're at the bottom looking up.
Okay.
And it's, to me, I just think Zion's is just incredible.
Well, and I feel kind of dumb because I lived in Montana and never went to Glacier.
Oh, Glacier's amazing.
Yeah.
The road to the sun.
Yeah.
Oh, it's absolutely.
I'm like, well, that was dumb of me, but
yeah. And I want to see Mount Rushmore.
Have you not ever been there?
No, never done that one.
I did when I was little. But I only remember seeing the weird
never
faces.
been there. Yosemite. I haven't been to Yosemite. I've been literally like 2 miles away and I didn't even go. And it was just, in fact, that was only a couple of years ago. And I can't believe I just
You kind of kick yourself for not doing it.
Well, I had just taught a course and it was towards the end of the day. I'm like, I'm going to barely even be able to get into the park. So I ended up not doing it. Anyways, what other life goals do you have?
I want to raise 2 good human beings. That's my mommy goal. I want my sons to be.
You want any more kids?
I don't know. I'm like 90% sure I don't.
You have 2 boys?
I have 2 boys, but I know that.
How old and how old?
So 8 and 2. They're 6 years apart, and they are the best of friends, and they fight all the time, and it's really cute. But I don't know if I can handle another boy like my youngest son. He's feral. That kid is wild.
You know what they say? You pay for your boys when they're young. You pay for your girls when they're old.
Yeah, that's true. That's true. But I know I'd have another boy, and that'd be my luck.
Well,
not that it's a bad thing. I'm just saying.
We have one that still is. We're always going to be paying for him.
Yeah.
But anyways,
that's the risk that you take when you have a child.
And that's how it happens. But it's so worth it with grandkids.
Oh, see, and I haven't reached that part of my life yet. I'm still in the fun mom stage. Granted, it's hard. It's the hardest thing I've ever done.
I got to tell you, one of my grandsons, it was the cutest thing. He's 4. They were over at our house on Friday, and he's 4 years old, and we've got all 5 of them there, and we had just eaten hamburgers, and a whole bunch of other things. And we had promised ice cream was coming, ice cream and cobbler.
Oh,
And so we were kind of playing in the backyard, and then I went in to go watch some of the Olympics, and I was kind of back and forth, and I
right.
sat down on the couch, and all of a sudden he comes in, and followed by two of his cousins, and he has a bag of Hostess white donuts. And I'm thinking, okay, where did you get these? I had no idea you had them. Anyways, he gives me the bag and he says, "Hey, Papa, can you get me a donut?" And I thought about it and I was like, "Yeah, sure. I mean, I'm Grandpa. Of course, I'm going to give you a donut."
Right.
So I open the bag and get him out a donut, give it to him. He is on cloud nine. Immediately, the two cousins go, "Can I have one?"
You gotta
Well,
give it
what
to
I
them.
didn't know is that their dad was the cousin's dad was in the room, and they go, "No, no, you can't have one." Right at that moment, my daughter-in-law of the two cousins that couldn't get a donut go, uh, the one that did, the one that got the donut said his parents just told him no. And I went, "Oop, I just made a mistake."
Mm.
But I didn't, and then I was like, well, I didn't know. So it was okay in my
Yeah.
eyes.
Yeah.
And so he takes a bite out of the donut because he hears this conversation, and I can see it in his eyes like, I got to eat this quick. And so he takes one bite. And it's just as he took a bite, his dad walks in. He looks back, he sees his dad, he takes another quick bite. He's got 2/3 of the donut down, or 1/3 of the donut down. His dad's like immediately says his name and walks over, and he goes, I'm just gonna say it. He goes, "George," and George looks at me and he goes, and he goes, and he knew he was in trouble, and so he starts to cry.
Oh.
And then his dad's like, "We told you can't have a donut," and he really crying now. But it's one of those like he's angry cries, but he wants to
Yes.
let everybody know, I'm not happy. Right at that moment, my son grabs his legs and starts pulling him, and it's literally like in a terror movie. You know when
Like,
their legs are getting pulled, and he has this terror look on his face, and then it immediately switched from terror to determination, and he took the entire donut and just shoved it in his mouth. I mean, the whole thing in one full sweep, and it went from I'm not going to cry anymore, I'm going to eat this donut, and he shoved it in as his dad is pulling him back in, and he's like, "You shouldn't have done that." And I hear him talking to him, and he got the donut down. I laughed so hard I couldn't help it. Well, come to find out the next morning, my son is telling his wife in bed, so this is Saturday morning, and he's telling her about the donut. And he thinks the kids are asleep. And he's just telling him, and they're kind of giggling about it. And he's like, "Yeah." And then I took him in the other room, and then George from the other room goes, "But I ate the whole donut." and, and it was
I
like,
knew it was George.
it was like, yeah, in your face. Now here's the crazy part. He still got ice cream. He still got a cobbler. So
Full
I
of
don't know.
sugar and send him back.
Well, you know
That's
what?
the job of being a grandpa.
Being a grandpa, I
Yeah.
was glad he brought it to me. He was like,
He knew he was going to get it out of
I
you.
know where I'm going to get it, and I'm going to get it from Papa. And
That's what my oldest son did with my dad. My dad would give him anything. Lawnmower rides were his favorite thing, and my dad would fill him with Oreos. And one time he gave him an entire Ziploc bag of Oreos to send home. And we were on the drive home, and I get to my apartment, and I look back there, and he had taken all of the Oreos, smashed them, and smeared them all over himself. He didn't eat them. He smeared them. And I told my dad, "You can't give him that many Oreos." Or the time my dad used to carry around pocket mints. They were like the sweet dissolvable mints, and my son loved them. Well, my dad had bought him his own pack. He ate the whole thing and then ended up throwing up on the floor. And I looked at my dad and I said, "That's your problem. You gave it to him. You can clean it up. Not my house."
Oh, so did he?
Yeah, he cleaned it up.
Oh, I don't know. I would, yeah, I don't do that very well.
No,
No, and I can overfeed them. That's true. Which son do you love more?
I love them both the same.
You have to answer.
I can't say no.
Yeah.
I love them equally.
Okay. Do you love your sons or your husband more?
That's a hard question.
It is not a hard question, and you know it, and you know that there is a difference.
I love them differently.
Yeah, that's the correct answer. Okay. With kids, there's a love, there's a protective love,
Yes, it's different.
right?
It's a love like I've never experienced. And I remember my mom always telling me that when I was, in college, you think you love him, but wait until you have children. It's different. And she'd
It
always
is
tell me,
different.
it's different. And then I had my oldest son, and we have gone through a lot together. I've grown up with him, and we've gone through a lot of heartache together, and being a single mom and trying to find a husband who's going to love him as I love him was one of the hardest challenges I've had. And I am thankful for my husband. I am thankful. He is a good man, and my oldest son views him as his dad, calls him dad. And, so it's different.
It is different.
It's different.
There's a romantic love that you have for your husband. There's a
Yes.
protective love that you have for your children.
Yes.
Out of the two, if you had to leave one or the other, you would leave the husband for the children.
That's just how it is.
That's the way that it's going to be.
Yep.
And that's important. They've done research in what happens with men. Men and women are very different as well.
Yes.
When kids get to that age of 18, 19, dads literally, biologically, are meant to kick them out the door.
Mm.
Mothers never, ever, their entire life, they are wanting to hold on.
Yes.
and be mothers. The only thing that changes is they can switch the motherhood from the child to the grandchildren.
Oh, that's true.
And if they don't have kids, then they're going to mother them the rest of their life.
See, and that's hard, is because my 8-year-old is starting to talk back and do things that I'm like, where's my sweet little boy? He's changing.
But
And
they're supposed to.
they are. And
He's
learning how to mother him differently.
He's
and
learning his
some
independence.
tough love. And letting him have some tough love and realizing consequences of his actions is hard for me, because I want to fix it. I want to make it better. And I have to step back and realize that my husband is parenting him, and to let him have that space, and to realize that, there's some things that fathers need to take over in, and that's okay.
Yeah, I think that's why it's important to have a mother and a father.
Mm-hmm. Absolutely. The family dynamic.
Yeah, absolutely.
Yeah. It is very important.
I mean, the village is helpful to be able to help with the entire child, but a family is the most important. Hillary Clinton, the village. I mean, come on. Anyways, so who do you dislike the most in the office?
I don't.
Who's the
like
one
anyone.
person like you that if you had to fire, you had to fire? This person, I can't. I came to you and said you have to fire someone.
Fire anyone.
You have to fire someone.
Fire someone. That's really hard. I like everyone.
No, you have to fire someone.
I don't want to make that decision. That's why I'm not the boss. And this is why I'm a hygienist and not a dentist.
Okay, who do you like the most?
Ooh. Like the most.
Okay, you're gonna go on a girls' trip, and you're gonna go. You have a free trip, all expenses paid, and you're gonna go for 1 week to an all-inclusive resort in Mexico.
Marjorie.
There you go.
She is my right-hand woman. I rely on her. I love her. She works so hard. She's so knowledgeable. Where I leave off, she picks up, and vice versa. We just are.
Who did you room with in Europe when we went?
I was by myself.
You had your own
I
room?
had my own room.
How lucky.
It was great. That was great. I had my own room, so I could do whatever I want. It was great. Yeah.
That was a fun trip, wasn't it?
It was so much fun. Because I have so many good memories from that trip.
And
And I
that was
just,
kind of the beginning of your
hmm
employment.
yes, I'd
And
only
then you
been there
go,
a few months. And I'm like, okay, the fact that he would take a chance on taking me on a trip after being there a few months, I don't know. I feel so lucky. I'm
so it's
thankful.
always been kind of in my mind that there's, you know, how you go into some offices and there's seniority and this
Hmm.
person's work and you have to listen to that person.
Yeah.
And there is even in our office to some degree, but it's an unwritten rule
We're
that
all kind of even keel. Like
that's
we're all on the same page because we're all a team working together
exactly.
to do the best that we can and be better each day. And
Other than Deborah throwing away my protein powder because it was too old. Are you kidding me?
she
Oh,
threw away your
she
protein.
threw away my protein
That's
powder.
like you can't do that.
And then
I
she's
did
like,
see one on top of the cupboard though.
no, because I put the other one there. And she's like, well, because it was the expiration date. I said, read it closer. It says recommended date. And
This is
trust me,
true.
with me, unless it's green inside, I am still going to eat it. Oh,
Well, you have an iron stomach. That kind of helps.
well, yeah.
Yeah.
To yes and no.
Yeah.
Well, Sam, thank you so much.
Thank you for having me.
This has been really fun, and thank you. You're wonderful with patients.
Thank
You're
you.
an incredible hygienist.
Thank you.
And someday, let me see what I can do to help you with your teaching opportunities.
Okay. I would love that. I appreciate you.
You bet. Thank
Thank
you.
you.
Okay, bye.